It's World AIDS Day, the 40th year of the campaign to highlight the virus and its often devastating consequences. It's largely taken a backseat in recent years, especially since the COVID-19 pandemic, but AIDS remains the biggest killer in many parts of the world. Well, joining us now to discuss this is Danny Bills. He's Head of Policy and Campaigns at the National AIDS Trust in the UK. Well, thanks for taking time to speak to us here on the programme. Are we overstating things? Have we forgotten the importance of AIDS these days?
I think certainly, I think it's easy with the advances that we've seen in medical research and treatment. 40 years on since the start of the epidemic, HIV is and doesn't have to be a life-ending condition. On successful treatment, people can live long, healthy lives and can't pass on the virus, which I think is incredibly powerful development and message to share. So I think in that context, it might be easy to forget the importance of HIV and AIDS in the UK, Europe and globally. But we've seen actually during the coronavirus decreases in HIV testing, increases in the rates of late diagnosis, and still new infections are happening. So there's still a real challenge that we have to face up to. And with all those tools, with all those new medical advances, we really do have the possibility now of ending HIV transmissions completely in the next 10 years by 2030, which is the national ambition now in the UK.
Well, you mentioned the many challenges which the world is facing, not just the UK. How big of a problem is it globally?
Oh, it's still a significant problem across the globe. It still takes many lives. Millions of people have lost their lives since the start of the pandemic. That continues. Access to medicines, and colleagues who work internationally at Stop AIDS and other organisations say that coronavirus rightly has taken a lot of attention globally. But there are other health threats, and HIV and AIDS is still a significant health challenge globally, as well as in many countries in Europe as well, like the UK.
Okay. Well, how will your organisation be marking World AIDS Day?
So, as I said, today really marks 40 years since the start of the epidemic. So I think it's particularly poignant. As always, we remember those we've lost far too soon. We celebrate their lives. And this year, the UK government has released a HIV action plan, which is of particular relevance. So we'll be analysing that plan, responding to it, sharing it amongst our supporters. And there's really good things in there. So more money for HIV testing, a commitment to make PrEP, the HIV prevention drug, more widely available, which is much needed. But certainly there's going to be a need for us to continue to campaign, as we have for the last 40 years, for more access to treatment, more access to prevention tools, and for no one really to be left behind, because we can't end HIV until we end it for all communities.